We're going to run through some taping considerations now, and firstly, pre-taping. Before we start any of our applications, it's vital to understand the importance of patient assessment. Your first responsibility is always to fully assess the area that you're thinking about taping. Whether you're a seasoned taping pro or a first timer, the same principles always apply when using tape. Step 1. What needs supporting or protecting? Assess your patient to analyse what areas are causing the issue. Are there any anatomical structures in the area that you need to be aware of or need to avoid? A good example of this would be the base of the fifth metatarsal in the foot, which can cause some irritation if you apply too much tape pressure in that area. Step 2. What movements need promoting or restricting? Is the pain being caused by particular movements that you may be able to prevent through taping? For example, if pain is caused by lateral rotation, then tape to help prevent or minimise lateral rotation will help to reduce that pain. Many of the applications we'll look at later in the course are biased towards one direction. Using the tape to help remove or reduce that movement may help to reduce pain and increase the function of that joint. Step 3. Do you actually need to use tape or strapping? Once you've made your clinical assessment on the area, you can start to think about whether taping or strapping is going to be suitable as part of that intervention. Will it be suitable for what you're trying to achieve? Are there other modalities that may be more effective? Is there any sign of inflammation or surface infection? In this instance, you would not tape over that area. Does your patient have a latex allergy? Some tape products, not ours, contain latex traces. Therefore, your patient may have an allergic reaction. We're not going to want to use tape with these kinds of patients. Step 4. What's the best tape or strapping to use? If you think tape or strapping is indicated, then consider which is going to work most effectively. Do you need a rigid tape to restrict movement or a lighter bandage for compression or support? In addition to this, do you think you need to use a pre-tape spray for more adhesion? Step 5. Be flexible in practice. Don't be afraid to change applications from how you would normally tape. Many of the applications I use now have been developed over time. If you're new to taping, then practice as much as possible. The better you are at handling the tape, the more effective and accurate your taping will be. You'll need to be flexible when working in sport, as more often than not, you'll be taping in the field. It could be the side of a boxing ring or an away team dressing room. Having an organised tape bag and a good supply is a great starting point. This will allow you to adapt to whatever sport throws at you. And now some really important post-taping considerations. Observe the patient's new range of motion. Have you achieved your desired outcome? Seek expert opinion. If you're new to taping, ask an experienced professional to check your application. Circulation. Check the capillary refill. Does the nail bed return to colour quickly enough? Allergies and skin irritation. Check for any reactions. These include itchiness or irritation. Remove tape immediately if any of these occur. Sensory response. Check the sensation in the area and make sure there's no adverse changes.